Charnita.
Thank you.
It is such a privilege to be here with you today. And I have to say that there's, among kind of professional and practical topics, there's no topic that I would rather, oh, I see what happened. I'm sorry. There we go. Exercise has been my favorite topic for many, many years. Now, before I start, I have a question for you. Do you see a smaller PowerPoint slide on the screen, or?
Yes, I think we're seeing your notes.
I don't know how to.
So I guess if you exit out of this.
How to switch the screens, because I have two screens here. On my other screen, I have the full size. And on the one screen that's showing up in the share is the smaller size. Charnita, do you have any insight on such a predicament?
Let me see. I guess try exiting out of this.
Okay.
Then you can share your PowerPoint again, and then I'll take a look from there.
Okay.
Also, otherwise, if it's easier, you could send it to me and I could share it.
Okay, you know what? Let me, it gives me a chance to click on, there's a screen 1 and screen 2.
Oh, it's working now.
Okay, wonderful, good. Okay, well, I was myself, I'm sure a lot of us were active as kids, and that was back in the days when you could just go out of your house and, you know, walk pretty much anywhere when most of us were kids, and times have changed so much, unfortunately, in that regard. But I was always into playing basketball, baseball, or football, whatever the season happened to be, and then eventually started running track in middle school and high school, and just a little bit at Penn State. And then I've just been an active exerciser for my entire life. But my mother actually read a book, the first book written for lay audiences on particularly aerobic exercise, way back in the 60s. I don't know if any of you remember a book by a Dr. Kenneth Cooper. His first book was Aerobics, and it had an elaborate point system where you had to accumulate 30 aerobics points a week to be in significant cardiovascular condition to prevent chronic disease and increase our quality of life and help us live longer. So my mom read that as about a 50-year-old housewife. And so she was a great role model. Pretty good when your own mom is exercising. And that was back in the days when, you know, 1967, people weren't just out jogging in those days, and there wasn't a fitness center on every corner back in those days either. So she was way ahead of the curve. She cross-country skied until she was 78 years old. And it isn't that she couldn't propel herself, it was that if she fell, she couldn't get herself up. So she stopped at that point. So I'm going to continue in my mom's legacy. And I went to Penn State and switched majors to what I realized finally was my passion, and that was health and physical education. And then I got a graduate degree in exercise physiology. And again, that's pretty much been my passion since I was about 4 or 5 years old. So I'm just going to share a few of the things from the guidelines from the Center for Disease Control and the premier kind of health and exercise professional organization called the American College of Sports Medicine. And they're tied in closely with, we've heard of the American Heart Association. And I'm going to share today what the guidelines are. Now, some folks are able to eventually meet those guidelines. Other people are not, but it doesn't matter in that regard whether someone is meeting the guidelines or not. What matters is that we're making the effort to do some regular exercise, and that will enable us to enjoy some of the health benefits of exercise. So today, we'll talk about the health benefits, then we'll get into some of the how-tos toward the end. Okay, so as we know, anyone who is trying to fight off or who has some degree of dementia or Alzheimer's disease, it's very important to eat healthy meals and eat regular meals. Junk food just won't cut it, and not eating won't cut it either. And then we know if we maintain social contact, that helps us as well. Not only have a better quality of life, but it helps engage our brain to a higher degree. And then I'm sure that there are some watching today that maybe either play Scrabble or do crossword puzzles or Sudoku or something to give you some mental gymnastic experience. And that helps maintain our mental function as well. And then another one that particularly has been shown to delay the onset of dementia and Alzheimer's and to increase the quality of life in various ways that we'll talk about briefly, is to exercise regularly. Now, some of you may have been like my wife. It's kind of the divine joke that my wife and I got married. I was in the doctoral program here at Temple in exercise physiology. She was one who hated gym class all her growing up years. So how we ever got together, the Lord only knows, but we've been thankfully happily married for 34 years, and it worked, but it wouldn't have been a likely match if anybody was sitting there trying to plan. So again, today we'll just focus on exercise. Now, the way to succeed in exercise is to make it part of our daily routine. Now, different days might be different. Some folks, have a schedule of your favorite TV show or when you're going to eat your meals, doctor's appointments, things like that. If you are going to go out to the store or something, then if you schedule that in, then we're more sure to do it and be able to fit in all the things that are priorities for us. So exercise is on that list of things that we should write into our schedule. So for some folks, it's before a meal or after a meal, or before or after your favorite TV shows, before or after the news, after taking a nap when you feel refreshed. Doesn't matter what other daily event you're tying it into. Just the fact that you do have a regular schedule, that it's just natural then you get in the habit of exercising at those times. Now, of course, we're going to miss now and then. That's okay. But it's the habit, the daily typical routine that is the key. So why exercise, especially if you're one who just weren't one to do regular exercise and more physical activity and planning it in and doing it? Like, why go to that extra trouble? Basically, it promotes good physical health. If we live a healthy lifestyle involving, as we said, nutrition and all these other things, we brush our teeth, we do our preventive medicine checkups, and you've been getting colonoscopies for years and all those sort of things. It's all part of a healthy lifestyle. But exercise and physical activity is one of those things on the list. So it improves our health. Okay, and it also helps us with our activities of daily living. we'll just say it keeps us more functional longer. If people do not exercise, just like if they don't exercise their brain, it gets weaker and flabbier, shall we say? And exercise the same way. It aids with our activities of daily living so that we can do the things not only that we need to do, but also recreational things, activities that we really like to do. Okay, so let's basically, if you can fasten your seatbelt now, there are a lot of benefits to exercise, and this, I'm not going to cover all of them, but I'll cover a bunch, and we'll just take a quick peek one at a time. So most of us know that exercise makes our heart healthier. It helps to keep the arteries in our heart clearer longer. We have what's called atherosclerosis, or clogged arteries. Another term for these are lesions, or just blockages, occlusions, and they decrease the amount of blood that can flow through a coronary artery and supply our heart muscle with enough blood and oxygen. When the heart muscle, just like any tissue in our body, doesn't get enough oxygen, it doesn't like that, and it doesn't perform as well. And what can happen then, if we have a buildup in our arteries, then we're likely, the body reads that as an abnormality, as a rough area. Like if we get our blood drawn at the doctor's, it clots fine afterwards. None of us have bled to death yet. We form a clot, and it prevents the bleeding from going on for a long time. Hopefully, if we're taking blood thinners, obviously it's harder to get it to clot, but eventually it does clot. Well, the body can read the atherosclerosis, where the buildup is here, as a problem, as an abnormality, and so it starts to form a clot. That's not good. So that can cut off the entire blood supply and cause a heart attack. The fancy term for it medically, some of you have heard the term, or you might have been in a medical field during your career, myocardial infarction. Infarction is tissue death. If you can have an infarction in the brain, in the kidney, in the liver, any organ in the body can have an infarction, or they shorten it to infarct. And obviously the heart muscle is one of those tissues that can have experience tissue death. So exercise helps to keep these coronary arteries, the arteries supplying the heart with oxygen, it keeps them clearer longer. Even if it doesn't prevent the buildup in some people because of genes and just because of age, it will slow down the progression of the buildup. So it helps to either prevent a heart attack so it never happens, or it will delay a heart attack, can be for years, so that even if you have a family history, my dad passed away on the tennis court of a heart attack at 64. Well, right now I'm 67, so I've outlived my dad. And I was just at a cardiologist yesterday. My primary care physician wanted to play it safe, that even though I seem healthy, I have no chest pain, no symptoms, because I have that strong family history, he didn't want to take any chances. So he wanted me to always be followed by a cardiologist from here on, and to get preventive checkups. So I just went yesterday, and my cardiologist gave me a clean bill of health. I can still jump on the treadmill with my students and try to show them how it's supposed to be done. Not exactly. I can beat 80% of them on the treadmill, but there's still 20% that can leave me in the dust. But someday maybe, I hope I don't have a heart attack. Someday maybe I will, but it was delayed. Didn't have one at the same age as my own dad. Some of you, if you think back to the 60s and 70s, there was a book written by a writer named Jim Fixx. And he wrote a book called The Complete Book of Running. He was not an exercise physiologist, but he turned over a new leaf and started running, eventually running marathons. He died of a heart attack. So people would say, oh, then don't run. That's going to cause a heart attack. Look at this guy. He wrote the complete book of running. Well, actually, if you dig a little deeper, and unfortunately, not all newspaper articles did the extra digging, his dad had his first heart attack at 37 and passed away at 43. So this Jim Fixx had a horrible family history of heart disease, and he passed away at 56. Now, we don't know if he was feeling chest pain, and as you know, some runners, they just grit their teeth harder and just keep running even if they feel a symptoms, some of them. We don't know if he had symptoms, you know, any warning signal or not, but he outlived his own dad by 13 years, even though he had the family history and had been a very heavy smoker earlier in his life as well, and he lived to be 56. Okay, so our exercise, it either will put off a heart attack, it will delay it, or it might prevent it entirely. And also, some of you may have a heart condition called heart failure. That's not where the heart stops beating. Heart failure is where the heart can't pump out as much blood with each beat as it used to. And so it starts to, the heart rate will go up as a result of that because the heart's trying to supply enough blood, and it gets thicker and thicker eventually. And it becomes less and less efficient as the years go by. And so exercising throughout one's lifetime helps, again, either to delay or to prevent heart failure later in life. For some folks, it's just genetic. They're going to get it. One of our most famous exercise physiologists in our field over the years passed away of heart failure at 76. But if he hadn't exercised, you know, he might have died at 60 or whatever of heart failure. So in his case, you know, it delayed it, but the gene pool and all, he did eventually, you know, pass away from heart failure. But, you know, we're all going to die of something, as they say. And, you know, at least he lived to be 76. Okay, now exercise will help to eliminate some of the risk factors that cause this heart disease that we were just talking about. It will help prevent the buildup in our coronary arteries. So we're just going to run through the quick laundry list of the risk factors that exercise will help to either decrease or totally eliminate. Now, I doubt that any of you have had a plate that looked exactly like this. However, all of us can pick a few items off of here that we've eaten a few of over the years, and maybe more than a few. Again, it's not the occasional splurge that will get somebody and clog up their arteries. It's when it's a daily occurrence, when people are eating a regular diet of these kind of foods. And then, as we know, high blood pressure is another one. So exercise helps keep our blood vessels elastic so our blood pressure can stay normal. Okay, so that's what we want to do. We want to keep them as stretchy as possible and not become rigid. They can either get the buildup, which is atherosclerosis, and also the wall of the artery can become rigid and hard. We've probably all heard of arteriosclerosis. That's the hardening of the arteries. So people can either have one or the other, or unfortunately, they can also have both at the same time. So exercise will help prevent both conditions. And that helps to keep our blood pressure normal. Now, for those that do develop high blood pressure, it is crucial that they take the medicine that their doctor prescribes them on cue, shall we say. I unfortunately use my father-in-law as an example. He was one of the smartest people I have ever met. He was a problem solver in life. He could fix anything, whether he had experience with it or not. He had majored in mechanical engineering in school, and he was just natural at that. Unfortunately, what he wasn't natural at was taking his blood pressure medicine. He did take it regularly, but he didn't take it often enough. He took it the day before his annual doctor's checkup. And then he would waltz into the doctor's checkup. His primary care physician would take his pressure. And by golly, it was normal every year. It was just fabulous. And then he wouldn't take it again until a year later before his next checkup. Well, he started having heart attacks and then strokes at 65 years old. He lived to be 79. I mean, people can take their blood pressure medicine and not live to be 79. And he didn't take it for his whole adult life and still lived to be 79. Well, his dad lived to be 90. He had the genes to live a long time, but he didn't take advantage of that. So untreated high blood pressure causes heart failure and heart attacks and kidney disease and all kind of things. So if you've been prescribed, they call it antihypertensive medication. Hypertension is just high blood pressure. So if you've been prescribed medicine for it, be sure to take that medicine on schedule. Get help, get your family members to help either remind you or set up a system or something to take that. And obviously all the medications we've been prescribed all have their place in keeping us healthy. And they're all important, but high blood pressure medicine is one of them. Also, just a reminder, anyone who wants to jump in and ask me a question about any of these as we're rolling along here, feel free to do that while that thought is on your mind. If you're like me, if I wait, then I'll forget it. So feel free to just jump in and please interrupt me. You won't be interrupting. Please ask your question while you're thinking of it. Okay, everybody's heard of cholesterol. Some of us have heard, well, there's bad cholesterol and good cholesterol. Here's a tube of blood, and in addition to cholesterol, I have to mention, we have another fat in the blood called triglycerides. Now, all of us have good cholesterol, bad cholesterol, and triglycerides in our blood, no matter how low risk we are for heart disease. It's natural to be in our blood. What isn't natural, and what some people have bad genes for, is that we'll have unhealthy high levels of triglycerides and bad cholesterol. We want the good cholesterol, the HDL, to be high, and exercise helps to control these. Here's a tube of blood of somebody with normal, healthy triglycerides. See how the red and white blood cells and platelets sink to the bottom? And then the clear, sort of translucent serum stays at the top, and they pop it in a centrifuge, and this is a waxy serum separator so that the red blood cells don't contaminate the serum. And then cholesterol and blood sugar and liver enzymes, kidney function tests, all kind of things are taken by molecules and ions and things that are in the serum here. This other tube of blood is somebody with very high triglycerides, 500 or above. It should be 150 or less, ideally less than 100. This is somebody who's anywhere, the highest I've ever seen on somebody was 1200. Well, this is the wallpaper paste here of some in their blood of somebody whose triglycerides are probably around 1,000. Can you imagine this is floating in some people's blood? So exercise and obviously diet is crucial, as we know, for controlling these, but exercise helps, okay? And again, that reduces our risk of having a heart attack someday. Now, my HDL goes up 15 points. Thankfully, I'm able to exercise fairly vigorously. I don't know how many years I'll be able to do that. Not everybody can do that, but exercise, and also if someone has a lot of extra weight and they lose some weight, that helps raise the HDL as well. And so mine goes up 15 points when I do more exercise. Okay, blood sugar control, trying to manage, and if we don't have it yet, trying to delay or prevent the onset of type 2 diabetes. So when the blood sugar gets to be above 125 on multiple readings, then a person is diagnosed as a card-carrying type 2 diabetic. So they have to take their blood sugar and all. So exercise burns up some of that extra sugar. So if someone is a diabetic, they should never exercise alone, because their blood sugar could drop to an unhealthy level. We want it to drop within a healthy range, 70 to 100, but we don't want it to drop much below 70. Otherwise, a person's going to feel lightheaded. They're going to start to be very confused, and ultimately it's life-threatening. So if you're a type 2 diabetic, or type 1, doesn't matter. If you're a diabetic, never exercise by yourself. Exercise with a buddy, with a family member, a friend, someone who is with you that could call 911 if that ever happened. So obviously we don't want too much sugar in our diet. We want to decrease the amount of sugar in our diet. We want to take our blood sugar readings regularly, and we should take it if we're going to go out, if we're going to do some walking or something like that. If we're able to do that, go out and walk with a family member or a neighbor or whatnot, we should take our blood sugar before we start. It should at least be up in the upper 80s or in the 90s. So if it's below that, then have a little drink of juice, have a piece of fruit or something that will raise the blood sugar before you exercise. Okay, now it took a lot of years for researchers to find this out. Molecular researchers, they studied the chemical environment in the walls of our blood vessels. Boy, what an exciting job. Can you imagine driving to work every day? What are you going to do today? Oh, I'm going to study the wall of blood vessels day after day after day. Okay, so for most of us, that doesn't sound too exciting. But for those who do find that exciting, as they say, different strokes for different folks, they found that what caused the buildup is the chemical environment changes when the wall of the vessel it becomes inflamed. And so there's a blood test that can be done that called highly sensitive C-reactive protein. And if it's real high, that means the person is at high risk for having clogged arteries and eventually having a heart attack. So some of us, and myself included, are taking a statin drug. And those statin drugs are great, not only in keeping the LDL, the bad cholesterol, low, it also takes away inflammation. And if the walls of the vessels do not have inflammation, then the buildup either slows down or it stops, or in some cases, it can actually go backwards and it could eat away some of that, particularly if someone's exercising and taking a statin drug. Okay, so statin drugs are great for stopping that bad chemical environment of inflammation. Okay, so again, exercise helps decrease inflammation in addition to statin drugs. Exercise does it naturally, so that decreases the risk of a heart attack. So it really keeps our vessels of our heart healthier and keeps them cleaner. Okay, now, if we have blockages in our hearts, we can also develop blockages in arteries in our legs. That's called peripheral artery disease, PAD or PAD. And if someone has that, they start to get leg pain, particularly if they exercise. Initially, they could walk a mile and then their leg starts to hurt because it's not getting enough oxygen due to the blockages. during exercise. And then eventually they walk only short distances and they start to get this pain. It's called claudication or intermittent claudication. And then it becomes so bad they even get this claudication, this leg pain at rest. Well, those folks then are strong candidates to get surgery, where vascular surgeons, vascular specialists will take arteries and will put it in the areas where the arteries are all clogged up. And then the leg muscles can get enough oxygen. And then that does away with this claudication, this leg pain, due to a lack of oxygen to our leg muscles. Just like we can get lack of oxygen to our heart muscle, it can also happen in the legs. Okay, now a very practical side effect of exercise is particularly with walking, because it's kind of, there's movement with our body. It kind of jiggles our body a little bit, and it helps keep the food moving through our intestines, our small intestine, and then our large intestine. So if we're just riding a stationary bike, it won't affect it much. But if we're ambulating, if we're walking, and people that are joggers, you know, they have even more bouncing, so they get even more of an effect. But walkers also are bouncing to some degree. So also help strengthen the bones. If we're doing weight-bearing exercise, again, cycling generally won't affect it, swimming won't affect it, but weight-bearing exercise where there's a little bit of trauma every time our heel goes down on the sidewalk or on the road, okay, that little bit of trauma basically will strengthen our bones. So it also has the effect of increasing bowel movement. So that prevents constipation, helps prevent the outpocketing of tissue in our colon called diverticulitis, inflammation there. And diverticulitis, food can get trapped in there and it doesn't come out. Then a person can actually develop colon cancer as a result of that. So exercise.
I wanted
Yes.
to interrupt briefly. There's a question in the chat. So someone asked, is that different from varicose veins?
Okay, that's a great question. Okay, this peripheral artery disease is clogged arteries. What varicose veins are, inside of our veins, we have little teeny valves. Now, our veins, our arteries have plenty of blood pressure. The heart pumps hard enough to generate enough pressure to push the blood and give the red blood cells a round trip ticket. That blood will go all the way out to our arms and legs, all the way to your big toe or to your thumb. And there's enough pressure to push it all the way back to your heart. Well, what can happen is in our veins, it's very low pressure in our veins. The blood is highest where it leaves the heart. And then as it goes through the vascular system, through large arteries, smaller arteries, then capillaries in our tissue. And then it reverses and starts heading back to the heart through small veins, bigger veins. And then it enters the heart through the superior and the inferior vena cava. Some have heard of that. Maybe not, you haven't heard it for many years. But so varicose veins, what happens is the one-way valves inside of our veins, some of those will rupture and they essentially break and they're not there anymore. And so more blood then slides backward against gravity or with gravity. And now we have a lot of blood in an area of a vein so that it bulges out and causes this varicose vein. And obviously it can become very painful. And that is another reason that vascular specialists are making a living. They do a lot of surgeries on folks with varicose veins. Okay, so those are not related directly to the intestines and to the bowels. And they're not directly related to peripheral artery disease because that's a buildup of gunk and sludge inside of our small arteries in the legs. So on the veins, again, the one-way valves rupture, and then the veins bulge out and become very painful. Okay, I hope that answered your question in a way that, that made sense. Okay, in addition to improving bowel function and preventing colon cancer, exercise also decreases the risk of gallbladder disease, interestingly. And then some other cancers that exercise also helps to prevent and to help to manage if someone does get it. If they exercise regularly, it is likely to go away faster, in addition to their other treatments of chemotherapy or radiation therapy or whatever it may be. So breast cancer, bladder cancer, lung cancer, and endometrial cancer, ladies. So exercise helps prevent certain kinds of cancer. Now, maybe 10, 15 years from now, they'll find out it helps other cancers as well. But these are the cancers that thus far, there's evidence from research studies that it clearly reduces the risk of these and helps to manage it better. Okay, and then exercise helps to decrease anxiety in folks, uses up some of our energy, and it increases, you've probably heard of, some of you have heard of endorphins and enkephalins and cephalins in the brain. They stimulate the same receptors that opium and opioids do, obviously at a more manageable level, but a way that actually will stimulate us to enjoy life more and also to make us more productive. So it decreases anxiety and helps to manage depression. Exercise now is from the American Psychological Association. They list exercise as one of the treatments for anxiety and depression. And then just overall, again, you stimulate those opioid receptors. We just have, our mood is better and just have a greater feeling of well-being. Last night, before I went to finalize the slides, I went to our fitness center here at Temple and did a little workout because I know that it would give me not only a better sense of well-being, but improve my mental function so that I could finish up my slides quicker and more efficiently. And just a feeling of overall enhanced quality of life, both psychologically, but also more efficiently with better physical fitness. So everyone, when they exercise regularly, again, whether it's a little exercise or whether it's a fair amount of exercise, whatever our body will allow us to do, then we will essentially help enhance the quality of our life. Now, having said that, well, actually, we'll get to this other point that I was thinking of. Another thing that helps is we have improved sleep, both the quality of sleep. We sleep more deeply if we exercise regularly. Don't lay in bed and stare at the ceiling so much. Obviously, of utmost importance is decreasing risk of falls, because when one falls, if they have a broken hip, obviously that gives a poorer prognosis. My mom broke her hip at about age 83, missed a step and down she went, and she passed away at 87. But that broken hip just slowed everything down. She walked with a walker after that. And so even if you have a walker, if you walk regularly, doesn't matter how you walk, with cane or with a walker or on a treadmill in a fitness center or whatever, if you're holding on with both arms, just any walking that you can do, even in your house, just walking in your house helps to improve your health and to decrease the risk of falls. Also, most of us here, maybe not all of us, but most of us have arthritis in some joints, whether knees, hips, shoulders. even wrists, fingers. Okay, exercise, a moderate amount of exercise will decrease arthritis symptoms. Okay, so that's imperative. Now, if someone likes to swim, cold water can make your arthritis symptoms worse. But if exercising in, so we say tepid water, more mild water, mild temperatures, up in the 80s, even up to 90, that actually helps arthritis symptoms, mild water. And then exercise will help prevent many common chronic diseases. Even it can prolong the onset of it. And then if one does come down with a chronic disease, it helps to manage it better and have a higher physical capacity and quality of life, even if they do get the disease. So things like MS, Parkinson's, folks that have a stroke, they can recover faster from their stroke, and they're less likely to have a stroke. Or again, it'll delay the onset of a stroke more years if one exercises regularly. Folks with spinal cord injury, again, their quality of life is improved with exercise. Fibromyalgia, chronic fatigue syndrome, AIDS, kidney and liver disease. And, these are some high points, some famous ones, but many chronic diseases, again, you can delay the onset of the chronic disease with regular exercise. And then if one does eventually get it due to genes, then it will be managed more effectively for more years with regular exercise. Okay, now we're going to run through briefly some different types of exercise. And these different types of exercise, we can perform them in our own homes. We can perform them outdoors in a yard or on your sidewalk or, any place that it's safe to walk. Or you can do them in a fitness center or at a park, local park. So it doesn't matter where you do the exercise, wherever you're able to do it and wherever it will fit your schedule and your personal situation. You don't have to go anywhere to exercise. You can do it at home and do any of these types of exercise that we'll talk about. So first, aerobic exercise. So walking, as I said, is very good. Again, whether it's on a treadmill, whether it's doing a loop, or whether it's back and forth in your kitchen or going from the dining room to the living room or whatever, back and forth even in one room, or there might be a loop where you go around the rooms to the front door and then to the back door, if you have a loop there. You can do it in your house. Again, you can do it in the sidewalk, walk around the block if you can. Now, oftentimes we need to do it with a buddy and we may need some help, and that's fine. We have to stay safe if we're going to do walking. Okay. And some may still be able to go to a fitness center and walk on a treadmill there. Don't be afraid to hold on if you need to, for sure. Also, people can either purchase a stationary bike or a recumbent bike that has a back to the seat. You can lean back and it has a very wide bench seat. If you're a little wider than you were when you were 18, then a bench seat might feel much more comfortable than trying to sit on a little bike seat. So we have a recumbent bike in our basement. I've used it a lot over the years, and it's a great way to exercise. And sometimes your neighbor or someone on your block will be getting rid of one. Snatch it up. You park it in front of the TV, and that really helps to pass the time while you're exercising, improving your health. Okay, this is called, the company is called New Step. It's like stepping up and down. It's like using a stepper, except you're not upright. You get to sit while you're stepping. Isn't that cool? Okay, so again, these are not cheap. Fitness centers have them. Cardiac rehab has them. But keep your eyes open in your neighborhood and tell your relatives if you see some of this equipment alongside the road somewhere, snatch it up for you. bring it to your house. And then there's Elliptical Trainer, which is very low impact. There's a wheel that goes around, kind of like a bike, but you're going back and forth and around at the same time. So it's very low impact, good for the knees, good for the hips. I developed some knee pain over the summer, so I now use an elliptical, and it enables me to do lots of exercise without aggravating that my knee. Now, a second type of exercise, in addition to aerobic exercise, we call it resistance exercise. Something is forming a load that gives us resistance of moving through a range of motion. So if you happen to have something within grabbing range, you could grab something small. Everybody's heard of using soup cans. You can use small dumbbells. And if some of you guys like Russ, you're still a strong guy, you can have family members for Christmas or your birthday or Hanukkah or whatever, have them buy you a slightly heavier dumbbell. Like some of you, a 10-pounder or 15-pounder. Excuse me, but you could use a 1-pounder, whatever works for you. But you do want a little bit of a load there. So you can do curls as the picture shows. Okay, everybody put your arms at your sides. And now just bend your elbow and bring it up toward your shoulders. And then bring it back down again. So you can do sets of 10, sets of 15. Ideally, you'll have a load that's heavy enough that if you do, say, 15, your arm will start to feel a bit tired. Your biceps will start to feel tired. You don't need to feel tired the first few weeks you do it. You're just getting your arms in better shape and toning the muscles. But then if you have a load that it starts to feel tired, when you're 15, you just feel like stopping. You could do a few more if you had to, but you don't need to. Just exercise till it feels a bit tired. You don't have to, leave that for the youngsters. Us oldsters shouldn't be grunting and gritting our teeth when we do these exercises. It should still feel good, but the arms are starting to feel a bit tired, then stop. They call that exercising to fatigue rather than to failure, where you can't even lift the weight anymore. Well, leave that for the 20-year-olders. Okay, then we have the overhead press. If everybody can hold your arms at your shoulders here, bend your elbow, hold your arms, and then lift it up over your head and back down. Now you can do one at a time, that's fine, or you can just do one, or you can do one going up while the other is going down. And these will help develop your tricep muscles in the back of your upper arms. And it also helps your shoulders. Okay, now, any of these exercises, you may have to adapt them due to pain in a joint. You may have arthritis, or you may just have a quirk in your joint. I've had quirks for years. Certain lifts, when I went to the gym, I avoided them because they made my shoulder hurt, for example. So, for example, you can either just go up halfway. If it hurts to go all the way up, then don't go all the way up. Just go up halfway. Or if you come all the way down, if that hurts, we'll just come down partway. Any amount that you are moving a load anywhere in that range of motion, even if it's just a little bit, you're still exercising the muscle. It's still an overload for your muscle, and it will help keep the muscles toned and burn some calories, and also help your joints. Okay. Okay, then there's another one called an upright row. You're sitting upright, but you're just going to lift your elbow up. Now you can do it with two arms. Lift both of your elbows up so your hands go up kind of under your chin here. And then just bring your hands back down again. So hands up to your chin, elbows out, and then back down. That's a good one for shoulders. Okay, help your shoulders. It also, the muscles behind your neck, it helps those, as well as your biceps. And then the lateral raise, you can see from the picture here on the slide, you're just bringing your arms straight out to the side and back down. That one you have to use real light weights because we don't have much mechanical advantage when we do that. You don't want to strain anything. So you want to be sure to use a light weight for that. But that strengthens the shoulders too. Now this one actually has a similar impact as the upright row. Most people, they can do the upright row without bothering their shoulders. For some people, this one bothers their shoulders, but you can also raise it going out to the front as well, or at any angle. It can be to the side, or it can be raising it up in the front. You can also use resistance bands if you don't have anything heavy in your home to provide enough of a load. They're too light for you. You can buy different colors of resistance bands. Don't get one that's too stiff, but don't get one that's too easy either. Try it out, go with someone that can help you to pick the right resistance on the band. And you can do any type of exercise. You can hold it down here and still go up like that, or put it under your foot and do curls, lifting it up this way. You can put it under your foot and still do overhead presses. If those who have a computer can go on YouTube and get more exercises with bands, or you can, physical therapists generally prescribe those, but there might be somebody that you know, even on your own block, that has used bands and can give you some more exercises there. You can also use machines. If you do have access to a gym, machines are very safe generally. You're not changing the weights, and you don't have barbells that are going to crash to the ground or anything like that. So machines are great just because generally they're safe, and doing some leg exercises are great to do. And then flexibility. You can lift your arm over your head, again, to whatever degree you're able, and you can start to bring it in closer to your ear. Then just gently stretch your shoulders. Okay, you can stretch your hamstrings just by sitting in a chair. You can have one leg kind of stretched out in front of you a little bit. Your heel is on the floor, and just gently lean forward a little bit so you feel some stretch in the back of your thighs. Okay, don't push hard, push very gently, and then just stop where you just feel a little bit of stretch. You can hold it for 10 to 30 seconds, release it, and then repeat that a number of times. Good to keep hamstrings stretched. It also helps prevent low back pain. Stretch our buttocks. If I was sitting, you can't really see too well here, but lifting your leg up, sitting in a chair, okay, that will help to stretch out your buttocks muscles. And if you lift your leg in the chair, it also helps strengthen your thighs. Calves, okay, you're standing up, holding on to a table or a chair or something. Put one foot a little bit behind your front foot and slowly press your heel down toward the ground, and you'll feel stretch in your calves. Okay, again, be very gentle with that. You don't want to push too hard. And then it's good for folks to do balance exercises. So initially hold on to something, do it with a buddy, have a spotter there. Eventually you can lift one leg up off the ground and put it back down again. And the longer you can lift the leg, then the more of a workout that is, and it's helping your balance. But not everyone can do those. So you have to kind of take it where your abilities still lie. But do it with somebody there to help spot you, and do it with a chair or something there that you can grab onto as soon as you need to. But for those who are able, lifting 1 foot off the floor, and then you can even lift your leg up, lift your knee up if you want. That's good balance training. Now, some bottom lines here. How much exercise is enough? First of all, as we said, any exercise is better than doing no exercise, like these folks here. It was suggested that they exercise, and they said, I think I'll watch TV instead. that's a problem. They will not get the health benefits. Okay, so aerobic exercise, how much should I do? You can start, I started here with 5 minutes. You can start with 1 minute if you want. Walk in your house for 1 minute straight and do that every day, or maybe do that a few times a day. And then eventually, if you can increase it slowly up to 5 minutes, eventually you might be able to do it, a month or 2 or 3 down the road, depending on what physical shape you're in and what orthopedic injuries you may or may not have. You go to 10 minutes, 15, 20, 25. The ultimate would be 30 minutes, 5 days a week. Okay, and that's 150 minutes. And that's the government guideline and the professional organization sports medicine, called the American College of Sports Medicine. Now, not everybody can do this. Not everybody will be able to do this. For those who are able, it might take you 6 months or a year or 2 years to get up to 150 minutes. That's fabulous. But if you do any exercise, if you're doing 5 minutes, that's 5 minutes more than if you were just sitting. And then you try to increase it from there, as we said, just slowly increasing the number of minutes, then you're going to enjoy more and more health benefits. And then resistance exercise. Start with just one set. Say do one set of curls. And I didn't put it on this slide, but 3 times a week, like Monday, Wednesday, Friday is a good regimen. And do it 8 to 10 times or even 15 times. Okay. And if you get a bunch of different exercises, we've just talked about a few today for the interest of time, but if you get up to 8 to 10 different exercises, if you talk to enough people and they suggest some worthwhile exercises, including arms and legs, do one set of say 10 to 15 times. 15 is good to shoot for, then it won't be too heavy. And then eventually you'll be able to do 2 rounds or 2 circuits. Eventually you might be able to do 3 circuits. Now you might not get up to 3, but it's certainly a possibility for some of you.
And along these lines, I just got 2 questions in the chat.
Okay.
So the first question asks, how important is it to do exercise outdoors?
Okay, that's a great question. If you have an outdoor area that is conducive to exercise, an area where, where you're not going to get hit by a car or hit by a 3-wheeler or a motorcycle or something else, or, and it's a safe area to exercise. If we do it outside, we tend to do more. If we do it inside, we can tend to do less unless we're really disciplined and kind of push our boredom level to be on, so exercising outdoors, if we're exercising in the city, there's always, a little pollution there. If you live out in the country somewhere, that's good fresh air. And if you live on a really busy street with a lot of traffic, you can exercise in your house and you won't have all the exhaust that's at a higher concentration outdoors. But just in general, if people are walking down the block and back or walking in their neighborhood or something, they're probably going to walk farther and walk more minutes than they would inside. So technically, it doesn't matter. You're moving. You're going to get the health benefits either way. But if there's a way that you can be pushed to walk further, walking outside will usually do that. Was there another question, Sharnita?
Yes, there's actually 2 additional questions.
Okay.
So the next question is about the intervals of the 30 minutes of exercise. So for example, someone wants to know, is 3 sets of 10 minutes throughout the day recommended, or are all 30 minutes at the same time for more experienced people?
That is another great question, and it took them years, it took them decades to research that and come up with a definitive answer. The new guidelines now say that it's just a total accumulated 30 minutes of activity. Now, then the question might be really, well, which is the best? Which will give me the best health outcome? And actually, it depends on what your chronic diseases may be. If somebody has high blood pressure or if somebody has diabetes, it's actually better to do 3 10-minute segments spread out throughout the day. Because then when you exercise, the top number, the systolic, goes up a little bit, but when you stop, the top number and the bottom number are going to be lower than before you started exercising. And they'll stay low for hours. Okay, so, or they can, and it depends how long a person is exercising. But every time that you say do 10 minutes of walking, okay, that's going to lower your blood pressure. And then later in the day, you do 10 more minutes. That'll lower it again. Later, you do 10 more minutes. That'll lower it again. So that's probably better than doing one 30-minute session. Now, what if you only have one segment in your schedule where you're going to be able to walk that day? Well, certainly do all 30 minutes, do 40 minutes, do whatever you can. It isn't like there's one is right and the other is wrong. It's just fine tuning. So again, if you have diabetes and you have high blood pressure, if you can, divide it up and do 10, 10, and 10, or do 10, 10, and 20 or more, if you have the time and the energy to do that. But 30 minutes all at one time is great as well. Okay. And for some people, that actually builds more endurance when you push yourself to walk 30 minutes straight. But also you can do 30 minutes and then stop and kind of take a little break, and then do 10 more minutes and stop and take a little break. You take whatever breaks you need to, so that you can exercise more minutes. A person shouldn't feel like they have to push themselves and do it all at one time, and then they're so tired afterwards, then they don't feel like exercising or doing anything their whole rest of the day. That's not good. So feel free to rest whenever you need to, but if you are able to walk 30 minutes straight, fabulous. Now, if you can, that won't provide weight control. Generally, people have to get up to 45 to 60 minutes of exercise in the course of a day for it to be burning enough calories to really help them to lose weight or to keep weight off. So, I mean, the recommendation is, if people can get to 150, great. But if you can do more than 150, if you're blessed that your body can still do more than 150, not necessarily today, but a year from now or 2 years from now, as you slowly increase it, that will give even more health benefit and will help with weight control when you have more minutes, because you're more minutes of calorie burning.
Thank you. And the next question is, should people get a personal trainer, especially when they will not do it on their own?
Sure, that's a great motivator. There are two things that are motivating. The personal trainer themselves are going to be excellent motivators. The other thing that's motivating is then you're paying money for it. And who would want to waste their money? So that helps to motivate you to put more into it as well. So for those who won't do it on their own, hiring a personal trainer is a great way to do it. And one way to do it more affordably is join a group session, because then they aren't going to charge each client as much per hour. And you're still going to be exercising with the personal trainer. What's the difference if they exercise 3 or 5 or a bunch of people? They're still there leading you in exercise, and you still are there having to follow them. So group exercise sessions can be much more affordable for folks. But whatever it takes to be motivated, and if you can get a personal trainer, if that's the only way you're going to do it, then certainly do it.
Okay, and I think those are all the questions we have currently.
Okay. Do we have time for a conclusion? Or not really? I know I'm already over the time. And folks, I know some of you have busy schedules, some have appointments to get to.
Well, it looks like we still have a good number of people on, so I think a conclusion would be nice. Someone in the chat
Okay,
said, please continue.
okay, so we'll wrap this up quickly. And in addition to aerobic exercise and the resistance exercise, putting a load on our muscles, then the flexibility, they recommend about 90 seconds per joint. So if you do 10 seconds at a pop and do 9 of them, that's 90 seconds. Okay, now you don't have to do that much. That's a recommendation. Again, anything that you do to stretch out your joints and keep them limber is a benefit. And you can start with 2 days a week, 3 days a week. If you do it more than that, that's great. That's even better. But even 2 to 3 days a week, again, is much better than not doing any stretching at all. Balance, they actually recommend an hour a week. Most people, that's a ridiculous recommendation. They'll never do that much, but that's the recommendation. But any balance exercising that you do, that we just talked about a moment ago, anything is better than nothing. So again, if you can add exercise to your routine to where it just becomes a habit, then we're more likely to do it regularly. And then we can enjoy all the different health benefits, reduce our risk of heart disease, peripheral artery disease, reduce our risk of cancer, help to straighten out our blood pressure, our cholesterol, and those types of things to make us healthier. If we add it to our routine, then we can enjoy those health benefits and also maintain our activities of daily living. Because over time, joints get stiffer, our muscles get weaker, and we get less and less, we can walk less and less. So for people that are sedentary, everything goes downhill faster. So any exercise we do will help us be able to walk further and walk a little faster. It'll help us to carry our groceries and things like that. Keep our muscles in shape. For some folks, it'll help to do yard work, even rake some leaves this time of year. And doing some flexibility exercises helps to prevent arthritis, and keeps our joints from stiffening up so much. So again, one thing to remember in life, remember to exercise. Hey, well, thank you very much for your attention today. And if there are any other questions, I'm happy to stay and answer those.